Yeah, hi, my name is Dr. Akash Rajpal. I'm the founder and MD of this company called EcoHealth. Uh, just before we start, I think we'll use technology just to make our presentation a little better. There's something called as a hash sign, which is there in every mobile phone, which is a universal silent key. So if somebody is just struggling to know how to silent their mobile phone, just long press the hash key and you'll put your phone to silent. It will make the presentation much better. And before I begin, I'll just briefly tell you about what EcoHealth is. Basically into this pyramid, where our tagline is making healthcare affordable, and which will actually culminate into the presentation, which is the context today. We have this pyramid which culminates into the center thing. So we improve patient awareness. We facilitate discounts for patients, especially targeting those patients who are into the unsecured, uninsured segment, 50 plus, or people who have diabetes, hypertension. So even if they can afford insurance will never put their money there because they know that they're going to lose. So they have a huge out-of-pocket expense. So what we are trying to do is reduce their expenses, cash expenses, by facilitating discounts. And to further go into making healthcare affordable, we are also providing consultancy services to providers to improve their efficiencies, getting them access to IT vendors like many of you are sitting here who can provide them cost-efficient infrastructure and various things which you've spoken about at the end of the day, so that the delivery is inexpensive and the care is inexpensive, and the patients benefit because they have to pay less out of pocket. So that is what EcoHealth is all about. This is a pan-India firm beginning from Mumbai, and you will be hearing about EcoHealth soon lately. To take this forward, what I'm going to talk about is leveraging IT in the healthcare ops, because there are hundreds and hundreds of solutions available, but at the end of the day, the solution has to meet a particular need. Typically, when we're talking about a healthcare scenario, I'm sticking today only to hospital because that is the biggest healthcare delivery in terms of patient care, because 80% of our care provision, when it is curative, 20% is preventive. So when 80% of care comes, it is again in a lot of private sector and small percentage of 20% again. So that 80-20 rule follows. So this is what a typical day in life is of a nurse, which is admission, assessment, placing orders, requesting consultations, asking for a RMOs to come, coordinate OT, laundry, housekeeping, front office, billing, lab, attending patient call bells, assisting consultants during round, give medication, consents, and the list goes on. What we are saying is, can IT help them there? There are tools available. There is hospital management software. There are many softwares which have auto alerts now. There is a central monitoring system which my colleague mentioned here. We have vacuum chutes which he has. We have picture archival systems which are there. We have transcription facilities which are there today, where you speak on a recorded system, or you write and somebody types it, or people around with voice dictation. There are so many things when it comes to transcription, and there is e-communication and telemedicine. But what I want to tell here is, and what I also mentioned as a thought in the previous session, is whatever has to be provided cannot, as a default, reduce productivity. So if it reduces productivity, that system is a failure. No matter how sophisticated the technology is, or how good that software is, or how good it looks, or what it can do, or it can store your information for eternity, and it has interoperability where you can have that thing seen by any hospital anywhere in the world, or even through internet, through secured passwords. If it reduces productivity, it is a failure. So if today a doctor sees 100 patients, he cannot see less than 100. If he still manages to see still those 100 patients and still have a lot of data analyzed and recorded, it is still an excellent system. But if it reduces even by one patient, it is not a good system. So that is where, when people realize that no, doctors are not accepting it or the nurses are not accepting it. This is the reason. We in India are aware of this fact that the demand is always greater than the supply. Patients always will be more. A corporate hospital also, which is expensive, in just few months or even years, goes beyond capacity. They have to expand. So that will always remain. So you can't reduce that. No hospital would accept it. So what are the objectives in having such a system which will help you streamline these operations? Is that it should get you to know what your workload statistics are so that you can do a course correction. It should be able to give you performance monitoring, both administrative and clinical, so that appropriate administrative and clinical decisions can be taken not in terms of diagnosis, in terms of supporting the diagnosis and in supporting decisions related to HR when you want to keep associated with a person, say for competency or for the support staff. For example, if I don't know from time to time that the catheterization infections are more in a particular department due to a particular person, or the surgical infection rates are more for a particular doctor, and the average length of stay increases more because of a particular doctor and in a particular department, how would I know whether I need to get rid of that doctor or that nurse or that staff? How would I know that? That is very important today because patients are becoming more and more aware. Today patients do not realize that there are 1,000 processes which goes behind, just like an airline, into creating good patient care. They are only worried about one thing, that I go into this hospital and I come back better. So they don't care what technology you use and what glam you show them. It doesn't matter. They are only worried about that thing, that I go there, I should not be charged more in terms of comparison in the market. That means it should be transparency in dealing with billing. Second is that the treatment for which I came, I should go back. So performance monitoring will help you there. Third, that the performance improvement projects which should be part of that entire IT system should be able to identify problem areas, and you should be able to have a reporting system which should give you a before and after data to say that, okay, yes, this is how it helped. And that is where my learned colleague in the morning said evidence-based in IT is what it will help. This is where evidence-based thing would tell you, okay, this is what is helping for achieving my objective of improving clinical practice and administrative connection. With accreditation going on and gaining more popularity, your software should be able to give you accreditation compliance. It means that if there are 64 parameters in NABH, your system typically and mandatorily now, it will be very imprudent if you don't have it, that system is not having those 64 parameters to connect with in the first place. You should be able to have systems where you can just enter that data very simplistically and very simple way to use. Dosage alerts, scheduled reminders, dosage calculations are something which nursing staff does beautifully just by using a simple diary. They just have the chit and the note in their lab code, and then they know that this patient requires this and this and this. They don't go and refer a TPR chart every time. But believe me, if you can give them access to a simple technology which is as simple as a phone, or even using your simple Microsoft Outlook and using calendar functions to enable them just to be reminded on certain things, it will be good enough. You don't need expensive IT systems there. We used simple things like email reminders, where we just gave them an interface where they entered, it went into Outlook, and they used to get alerts. This is the time for that patient. It used to improve their efficiency. That is where I said that they were able to do that particular task, say in an hour. Here they were doing more number of patients in that hour because they never forgot. Okay, viewing test results, ICU parameters, taking clinical decisions. My colleague here spoke about it. Is something, yes, it is necessary nowadays. But if you spend with the fallacies of that computer has not booted, and you know, there is a server downtime, and then suddenly there is a pop-up alert saying that the servers are going for maintenance, and now all those things which we typically see, then it's a failure. Then we have not thought through the system. And it definitely cannot go at your discharge time, which is between 10 and 2 in the afternoon. It cannot happen. If it has happened, that means you have not thought through that process. It is not the problem of that computer, it is the problem managing that the person who is not in the loop about the problems faced in a hospital. And definitely it cannot be in those frustrating hours of nursing staff who do handover and again the systems are not working. So these are the things which you have to look into, and everything what you do should improve productivity. So if today your hospital is seeing 1,000 patients and you're 90% bed occupancy, instead of adding more beds, if you can have technology to enhance 30% bed occupancy is what is required. That will repay your money in no time. That is what evidence-based medicine is all about. So IT leveraging further goes into SOP training, because if everything is available online in terms of parameters, and not everybody needs to carry around obsolete text which is printed, and we want to save environment and save trees also, so everything should be online. So it will help you through evaluation, self-learning, exams. I'm sitting at the desk monitoring patients there. I don't have time to go to training. I don't need to, because I can just open by click of a button one SOP module which I just want to learn. I will be able to learn just sitting at the desk here and monitoring the patient there. That is improving efficiency. That is improving your utilizing your IT to the fullest. I don't need to today I don't need to go to a large auditorium where I am already resource crunched of nursing staff. Why should I be removing one nurse from a desk and putting him into training into an auditorium? Use your IT systems, enable it. So you should be able to minimize breaks from activity tests. Statistics say that 72% of nurses today use email and internet daily. Only 1.3% nurses do not use internet or email at all. It's a very minuscule percentage. 73% of the total who use email and internet use it for their efficiency improvement process, clinical practice related things, so that they do that so that the time taken for each patient is reduced, so that the decision making is faster. It's a self-learning process, and they do that on their own. We don't provide that, though we can. It's a reliable resource, and this is what is something which we should be able to do. That statistic has got nothing to do with India or abroad. What it says is that as a nursing staff, there is another statistics which is not mentioned here. Only 40% of the American hospitals are digitized. India is more than that. It is about 60 to 65% of Indian hospitals are digitized today. Okay, when I'm saying digitized, that means they have access to internet, they have access to email, they have some form of hospital information system, be it rudimentary, be it clinical management, be it anything. But India is much more ahead in terms of American digitization of digitization when it comes to hospitals. So this is a philosophy, or in terms of the approach of nursing staff, even if it is not Indian statistics, it is a food for thought that yes, today information technology has reached out to masses with 3G and with mobile, even web-based access. Today, every phone here, you won't believe me, is internet enabled. Every phone, including if you just dial 0 on your phone, you will be able to go to Google, and you didn't know that. It's pre-activated. It's pre-activated. You just have to pay 10 paise per KB. If you do that, your bill would show you that. Okay, but it's pre-activated, but people don't use it. Nursing staff do use it. Just searching Google and say dose calculator or whatever. A lot of people do that. Okay, so this is American Academy of Nurse Practitioners. That is, yeah.
The demographics of nursing staff is very different in India. We cannot replicate.
You are mistaken. I think since morning you have this thing about demographics playing a huge role difference when it comes to healthcare. Believe me, it is not anymore.
In the interest of time, I think what we will do is we'll have a separate time for the question and answer.
Yeah. So that is what I can debate that with you later. Yeah. Yeah.
We both don't have solid data.
No, there is. I can share that with you later. But this is what I wanted to say, that whatever we want to do, it should streamline hospital ops and it should improve productivity. Thank you so much.